Hi, I'm Carl Relf from Cumbria County Council, and with me is Kate. Kate.
Good morning, I'm Kate. I'm the manager of the digital team at Cumbria. Carl's one of the team members. I'm going to let Carl do most of the talking because he's the one that's done all the hard work on this, but just as a bit of background and introduction to it, Cumbria have been using a low-code platform for the last, coming up 2 years now, isn't it, Carl? And we've been doing a lot of work to look at redesigning processes internally. Through the COVID stuff, though, all our resources have been pulled on to looking at various elements of supporting the COVID response. So firstly, vulnerable people, secondly, PPE, and then thirdly, the major piece of work that Carl's been involved in, which is track and trace.
The service had contacted us and had said we need to set up a contact centre. So organisations, predominantly schools in the first instance, could contact us and tell us if they've got a positive case, and we would then be able to start to trace those individuals. So that's where we started. We started with this this contact centre. Now, to assist with that, the actual tracing was going to be done by an NHS team. The NHS team were actually responsible for sexual health and tracking and tracing those with sexual health issues. So what they had is they had an existing solution in place, which was an NHS solution. They had a vast experience and knowledge within the area. However, what they were unable to do was they were unable to develop their solution within the timescale required. So at that point, we started to look at whether we could build something in-house as a replacement for their solution and cascade that to our wider partners. What we were able to do is we were able to develop a solution. Again, that was actually done within 12 days. So from initiation to having something workable within the services and across our partners, we were able to have a solution available. That included our Liberty Converse and Liberty Create. So we had the contact centre set up and sat on their seats ready to take calls. And we also had Liberty Create within multi-agency partners there as well. So we have a concept of we have the person. So initially a school was contacting the contact centre and they were providing us details of people who've had a positive test. So the contact centre are able to capture that detail from the school and are able to create a person. So within the solution, they start to create people records. So these are people who've had positive tests, and we can triage these to the multi-agency partners to then start the next part of the process. What we then do is we capture the organisation that that person's related to, and we create relationships to these people. So straight away, if we were to look at any school within the system, we can see how many people are associated with that organisation, with that school. What we then are able to do is our multi-agency partners are then able to contact each one of these index cases, each one of these positive people, and we are able to start to create links to contact cases. So this is the test and trace around, hi Carl, I can see that you've had a positive test, who have you been in contact with? And we can then start to create relationships between my contact cases. And again, keeping our relationships through the organisation. If we're looking at an organisation, we can step through to the person, and then we can see from that person the number of contacts that that person has had. Now, the next level from organisation, we are then able to group or start to create an incident. So if there was a number of people at an organisation who were positive, but what we're able to do is we are able to create an incident and link an organisation to that. So the incident then groups together all of the people and the organisations through the existing relationships. And ultimately, if these incidents are to start continue to grow, what we're able to do is we're able to link those further and create an outbreak. Now, it's the incidents and outbreaks that have been discussed daily at the moment at our incident management hub. And again, with the way that we've built the system, what we're able to do is when looking at an incident, you can count see a count of the number of organisations, the number of people, and ultimately the number of potential contacts that are associated there as well. So with setting our data up in this format, we're really able to drill down through those relationships and to identify exactly the scale of that incident, or ultimately the outbreak. Our person really follows a process. Now, what this process is doing is it's once we've contacted a person, we need to do these 5 steps afterwards. And having that within a predefined process helps us to make sure that we've got an audit log of all the times that that person was contacted. Also on the person, we're able to capture whether they're an index case, a secondary case, or a contact. And depending on that choice decides on the process that that person follows. And as I said earlier, we're capturing test results and we're linking to contacts also. On our organisation, we've got key contacts. We're capturing specific details around the school or an organisation. Once it comes to incidents and outbreaks, like I said earlier, what we're doing is we're capturing all of the people underneath that incident and outbreak, and we're able to do various things. We've got notebook functionality, so we can capture key actions, we can capture an incident owner, and really have that one version. There's a couple of screenshots on the screen here. Now, what we're able to do is we've done heat maps, we've published the number of tests that we've had done, we've published the number of interactions that we've had through the contact centre. And what we've been able to do is we've been able to build this comprehensive suite of reports, which we can publish to users of the system. So they can really start to capture and see that big picture around what's actually happening in Cumbria. Now, what we've also been able to do is we've also been able to strip out some of that confidential data, and we've been able to make some of that data open to other colleagues as well. So we've got a core group of users of the system, and what we've been able to do is open that up to multi-agency colleagues as well, where within the security restrictions. So heat maps, postcode lookups, all this sort of thing has really helped to capture that data. And just a couple of slides towards the end here, visible results. You may or may not have seen that Carlisle had an alert published at one point. So again, this is a screenshot of tweets that have been published. Now, this data was all captured within the Liberty Create system. We've been able to publish alerts to the general public to say, go and get tested. Here you can see the organisations that are affected. And obviously within the system, we have got all of the detail around potential people here who were positive and their contacts as well. We saw an increased number of demands. I think one of the mobile testing centres here in Cumbria had its busiest day the day after this tweet was published. So we really have been able to see it end to end. We've seen the incident growing, the potential for an alert, and then once that alert's been published, we've then seen the increased amount of interactions coming in and people being logged. And finally, just a little note around the positive feedback. There's a screenshot on the screen here now from our Colin Cox, who's our Director of Public Health. You can see there that we're saying around praising the team, praising our contact tracing team, environmental health colleagues around that. Now, where the system at the moment is being used by numerous of people, like I've been saying, we've got public health, we've got NHS using it, and we've also got our 6 district councils, environmental health teams using that system as well. And the number of cases that we're logging in there is growing. It's not necessarily growing around positive people, but it's growing around information around contacts, potential cause for concern as well. So, like I said, positive feedback received, and we've really started to see the benefit from that. We have also been able to share our solution within the Liberty Create community, and I believe that's what we're going to be talking around next.
Yeah. Smashing. Let's invite David Briggs. Good morning, Mr. Briggs.
Good morning. So I'm Dave Briggs, Head of Digital Operations at Croydon Council. We signed up to start using Liberty Create in January, and as part of our response to COVID, we rapidly built out some applications using it. Our shielding case management system was all in Liberty Create. We also did a business grants discretionary fund application process. We also developed an internal SITREP tool so that for business continuity purposes, so that everybody in the council knew who was working when and which services were running and which weren't and all that kind of stuff. And it's fair to say I don't think we could have done any of that stuff quite as well or as quickly had we not had this tool available to us. So that was great. The other fantastic thing, though, as Carl was just alluding to, I mean, I previously worked with this platform as well while I was at Adrian Worthing Councils a few years ago, and Adrian Worthing have been doing some fantastic stuff alongside Cumbria and others, and like Cumbria, they're sort of starting to share some of the things that they've built in the Netcall sort of community on the app share. So and you know, these things take a number of different sort of forms, but the most exciting ones, I think, are the ones that are called accelerators, which I think is how the track and trace thing is shared, isn't it?
Yeah, it definitely is, yeah.
Great. Which is basically you can just download the entire application and then start sort of bespoking it and customizing it to do what you want to be able to do. So we don't currently have a track and trace system in place. We're currently in conversation with the various sort of service areas to find out exactly what it is they want to do. But one of the first things we did do was download Cumbria's app and start sort of kicking the tires on that and hand it over to our devs so they can start having a play with it, so that we can understand what it can do and just how much time that's going to save us. And being able to do that is absolutely fantastic. So, and there's other stuff in that community as well. So again, Adrian Worthing uploaded, I think, a social prescribing app that can be sort of used and rolled off, and then also their sort of volunteer management stuff, I think, is up there as well, which is absolutely great. And again, you know, we're looking at social prescribing as a key part of our sort of new model of operating, really, within the council, trying to keep people out of hospitals and out of care homes and that kind of thing, increasing individual and community resilience. So that's a great thing that we can do. And of course, the best bit is that it's this sort of real sweet spot in between sort of off-the-shelf software and doing custom development, which is that actually you can take something off the shelf, but you can still figure it and customize it to meet the local need, which is absolutely fantastic. But at the same time, saving a load of time, and more importantly, I think in this day and age, a load of money as well, which is always really, really good news. And I think that on the broader point, you know, a lot of us on this call are organisations would have signed up to the local government digital declaration and stuff like that, which is really hot on code sharing. And the interesting thing, you know, people talk a lot about open source and all that kind of stuff, and we do a bit of that because through our work around our sort of web content management system project, which uses Drupal, which is an open source thing, which we're releasing all the code for, you know, that's all good stuff. But actually there's other ways of doing this, and that actually you don't necessarily just have to share lines of code and things like that. Actually you can share, whether it's sort of patterns or pre-built applications using low code platforms. It really is, I think, horses for courses in terms of, you know, picking the right thing to answer the right challenge. And so I think it's great. But as well as those accelerators, the other thing I just wanted to mention is that there's bits that sort of Netcall themselves are throwing in there, whether it's in the form of like plugins or additional bits of functionality that you can just pick off the shelf and whack into the applications that you're building out, which is really, really helpful. Obviously, there's no technology silver bullets; those things don't exist. This hits that real sort of sweet spot between off the shelf, co-produced and shared across the sector, plus that ability to customize to meet local need, which is really, really important. You know, and it's great that Netcall have seen this opportunity. You know, they could have been nickel and diming us for all of this kind of stuff, but they've chosen not to, and I think that's terrific.
I totally agree, and I think, you know, Cumbria's, you know, we are heavily invested in Liberty Create, and when we know it's not the only solution out there, but for our particular context, with a very small team, with limited budget, the ability to share apps with other people, the ability to learn from what other people are doing in that community is something that's really valuable for us. So yeah, it's not a silver bullet, no, but for our particular context right now, it is the way forward.
Definitely.
Excellent. Well, thank you all. Thanks, Carl. Thanks, Kate, for sharing the track and trace journey. That's great.